Good morning and welcome to the Institute for Strategic Policy Solutions. I am honored today to have our wrap-up session with Dr. Frederick Guerrier, who is an icon in our community and our state as a healthcare provider and an advocate for wellness. My name is Kimberly Jackson and I'm the Executive Director of the Institute for Strategic Policy Solutions. The Institute is a think tank embedded at St. Petersburg College at our Seminole campus. And it was created by former Congressman Bill Young as a way to make sure that we provided access and information in a nonpartisan manner and to ensure that we had discussions on social, political, and economic issues. Of course, this year we had a strong emphasis and focus on COVID and its impact. And after doing 2 series, we thought we'd wrap it up with an actual practitioner to discuss the ways it has impacted us. All of our programs are on isps.spcollege.edu, and we hope you learn more about us and follow us on Facebook. And with that, I want to get going to make sure that we value the doctor's time, and I'm going to do his formal introduction before he begins. Dr. Frederick Guerrier, known as Dr. G affectionately by all, was born in Haiti and came to this country in 1971. Despite not speaking any English, Dr. G graduated 13th out of 750 students in high school and went on to matriculate through the University of Florida. He received a degree in chemistry and went straight to medical school at the University of Miami. After graduation, he came to St. Petersburg for his residency. He owns his own private practice and has been practicing family medicine here since 1984. Dr. G has received many awards throughout his career. He has been named multiple times as Preceptor of the Year by the residence doctors, as well as Physician of the Year at all 3 hospitals he has practiced at in St. Petersburg. In 2010, Pinellas County Medical Association, and in 2019, Florida Academy of Family Medicine also named him Physician of the Year. He has been given the title of Florida's Top Docs and America's Best Doctor Award. He currently serves as the chairman of the Department of Family Medicine at Bayfront Orlando Health. Dr. G is most proud of the Star Student Award he received in 1972 after just 1 year in this country from the Florida State Chamber of Commerce. Welcome, Dr. G. I'm so glad to have you today.
Good morning. Very, very gracious
Good morning.
introduction. Still trying to get the frog out of the morning voice. Thank you so much. Very, very a good introduction. I think COVID has been, I would say, more than an eye-opener. It's been very difficult for just about everybody I know, and we all know that. Local, national, and of course, international now, very, very bad. In the office, in our little corner, if you will, when COVID started, we closed down everything. We do all of the safety precaution we had to, all the mitigation we had to. The office work at about 50%, where we make sure every patient has a temperature taken and taken to the back, and each room is clean after that as we go through the process of making sure. I personally, being a physician and still admitting my own patient to the hospital, I had to go to the hospital and had quite a few COVID dead. People have done for a long time to other comorbidities, other illnesses, succumb to the disease, if you will. And it was very difficult because at that point, family could not, and still, depending where you are, some family cannot visit a hospital for the family to come in. So whether it was FaceTiming or talking to them as much as we can, and some were lucky to be in a window, can maybe wave, if you will. But even then, that was very much of a problem. So it was very difficult emotionally, took a physical toll on us also, just to make sure we not only take care of the patient, but not forgetting that is a big family around that who wants to be around the loved one but can't. So it was very difficult. I don't think, not just for the family, also for the doctors and also the office staff, because I think the office staff get to know the patients. Every time something happened to somebody, we all mourn a little bit in the office to decide that. So things have been a little bit better. I personally, there's something I feel very, very good about. I personally been responsible to get a lot of people vaccinated. I actually called them myself, whether I use Metro Health, whether I use Bayfront, whether I use Northside Hospital. I've been able to call patient and make the appointment myself. So been very happy to do so. A lot of the patients, I see them, have been vaccinated. So we're able to relax a little bit more knowing they've been vaccinated. Some I even check for antibodies, if you will. And all the office staff, I've been vaccinated because I want my patients to feel safe coming in and to get there. Although we're still dealing with 95% with 2 vaccines, 65% no disease, 85% not getting a bad disease with J&J, it's still important to feel somewhat comfortable being outside or having a meeting with some loved one and maybe without mask, still following the CDC guideline on inside meetings. So things are getting better. I think we need to still have some leaders out there making people get vaccinated. I do believe that some of our own African-American folks, because of past experience, to have some problem getting vaccinated. I personally, and some of the folks that in my office, we are pushing them to get vaccinated. We have conversation why. And I took a picture of my vaccination. So I showed them the picture of the needle going into my arm with my face right there. So they know for sure it was me. And just trying to get them to get vaccinated. And I will continue to do so. You're here, we need about 70% herd immunity to get everybody vaccinated. Now seeing more of the younger kids with COVID or who are taking it home to the grandma, to the mom, if you will. The hospital are not as busy. I have one patient in the hospital right now with COVID, and I do wear all of the covers, if you will, the PPEs to make sure when I get in the room. And again, hand washing, very, very important, and everything else. So the hospital not as busy right now. We are really looking in Pinellas, a very big decline, not only in cases, but also in death. And I hope this continue. And the way to get this continue is to really start looking more and more at vaccination. And I'm willing to go anywhere to talk to anybody why they should be vaccinated. And because of that also, we can open up more and be able to, I guess, start enjoying life, and so on. Mm-hmm. So I really appreciate being here. I think on a personal level, we lived it every day. But we didn't shy away from it. We took care of people. And I have to tell you something interesting that I have noticed this year. And maybe the COVID vaccination has something to do with that, or maybe I haven't decided yet, but I've not seen that many people with the flu. And that's an observation I have not seen. Normally we see people with the flu, with the flu shot. I have not seen that many people with the flu. So I am not sure. I know we give a lot of flu shot in the office. We do that. We very much promote that too. But even then, we still see our share of flu disease, and I'm not seeing that. And that's an observation I've been talking to some of my colleagues about, and I've been trying to do some research just to see is there a cross reaction, because we know coronavirus exists everywhere. All you have to do is look at any bottle in the drugstore or in the Publix, if you will, for like another word. But coronavirus all over when you clean, but it was a different virus. So I haven't seen the flu, so that's something I'm looking for. So thank you for having me.
No, I'm so grateful for your lens, because again, we've had some very data hefty content conversations about what COVID is, but from a practitioner's perspective, can you explain what COVID looks like, how it manifests in different people, the different ranges of symptoms you see, and how you would explain it to for all this fear we have for those who have not experienced it personally, in an older person, in different races, and in young people, what it looks like up close?
It's a disease that robs you of your oxygen. And that's the underlying problem with COVID. You get robbed of your oxygen, your difficulty to breathe. And when you have a cold, you cough, you sneeze, but you catch your breath, you just feel kind of bad. COVID robs you of oxygen, the ability to breathe. And again, you have to be able to differentiate upper respiratory infection, a regular cold, and COVID. We have a joke where during COVID where you sneeze, people used to say, bless you. During COVID, you
Mhm.
sneeze, everybody either run away from you or tell you to get the, excuse me, out of there. So, so it wasn't nice because everybody was just so afraid of even cough. I mean, can you imagine you someplace just have a regular, everyday tickle in your throat and you don't want to cough, even with a mask on because you're afraid what people. So the sign is really an upper respiratory infection sign, not the typical sore throat, the runny nose, but more of a loss of taste, a loss of smell, some difficulty breathing. And most of the people, when we put them in the hospital, that's what we're dealing with, is a difficulty breathing. The oxygen saturation gets so low, we have to put these folks on steroids to make sure we stop the inflammation. And a lot of them, when they leave the hospital, we have to keep them on a blood thinner for about another month to prevent the clots formation that you see. So it's this, you feel miserable, you feel heavy, as I talk to my patients, and not the typical, MM cough that you have. And what's interesting, I had quite a few patients post-COVID that still have that sensation of fatigue, a sensation of, the fogginess. I just don't feel like myself. And I'm not about people who, may not want to go to work or people, no, I'm talking about people who have their own job or who stay home. It's just a fogginess. It's just, again, we've seen some athletes and who've had myocarditis. It affects your heart, inflammation. Quite a few of them stopped playing for the whole year. We're not sure exactly what happened. So again, different folks will have different reaction. But the thing we have to worry about when you're dealing with elderly folks, or and I know this is about health equity to some extent, who may not have access, who have comorbidities, whether it's diabetes, hypertension, heart disease, then you're wearing, if you will, all these diseases. And so therefore now you're not fighting just COVID. For example, you give somebody steroids to help with the COVID, now you mess up their blood sugar. And so now you have to tackle the blood sugar. So you find yourself running and fixing diseases. So one thing makes something better, the other one make the other one worse. And so even then, after they leave the hospital, you have to keep chasing the other illnesses to make sure the elderly or the other patient with a lot of comorbidities, if you will. So, and also it costs quite a bit too for the patient because these people cannot go to work, they're at home. Some may have opportunity to have a Zoom work at home, but not everybody. So we keep them at home for a while just to make sure they get better. So that itself also impact those folks' economic, vision also. So.
What do you think about youth? You mentioned children or young people, and they were bringing it home to different family members. I know that you also advise the Pinellas County school system on some level. What are your thought process about how we go back to school in the fall for our young people and how that's going to impact the different variants of COVID as we move into the fall and winter seasons?
Well, being a family physician, obviously we see everybody and the young children, and we talk to the family, making sure they understand that it's very difficult to keep young kids away from each other. I mean, I don't know how you can take some, fourth graders who are playing in the yards and the masks fall off and so on. And so again, the education have to come from home to make sure they understand at that age, if they have masks, then why they have the mask and what we are trying to do and so on. As we move further, now that Pfizer has the vaccination from 12 now to 16. And so the 800 kids from 12 to 16 who took the vaccine had no COVID. The other side, there was 29 or 20 cases or so. I don't know the exact number. So we clearly show the vaccination is working for the children. Now, whether or not it's a yearly shot, whether or not we need boosters, we're not sure yet. The interesting also, as I talk about kids to some extent, is the fact that, if anybody's having a baby right now, you need to have what they call a Tdap, which is a tetanus pertussis shot. They won't let you close the baby until you have that pertussis shot to make sure. So again, it's not like the COVID shot is a novelty. We take vaccination all the time for different reasons. So as we open up school, I think we need to promote as many vaccination 12 to 16 as possible. As we get the adult vaccinated, so even if the children get some symptom and they don't get that sick, some symptom, by having the parents vaccinated, then we'll be able to mitigate and not get anybody that sick. Now, remember, I was talking to a lawyer who I helped get vaccinated, and he asked me, would I get COVID? Now, being a lawyer, I decided to tell him there's a 5% chance you will, another 95% chance you won't. So that 5% chance, I'll take it any day. But we have to make sure the parent get vaccinated. We have to make sure the children get vaccinated. I don't think you can just open up school just taking just care of the children. You have to take care of the parents because they are going back home. So that's where we have to also use that analogy to get the parents to get vaccinated also. Yes, the kid's going to go to school. Get yourself vaccinated. So even if they bring something home, you are somewhat covered. So we have to look at both, not just one. We have to look at both.
Okay. I have another question about that. You mentioned the young people now having access approval for vaccinations. When do you think that's going to roll out in a pragmatic manner?
Daughter's calling. She had J&J, and I think she's calling to make sure. So I'll tell her I'm on a Zoom, and I call her right back. And she had J&J, and so I'm calling her every day to make sure she's okay. So there's a doctor and there's the daddy. The doctor said get J&J. The daddy said call me every day. So I do believe the Biden administration is trying to get Pfizer in the Biden administration. They are trying to get approval like yesterday, as soon as possible. So I expect this to be really within the next week or so. The problem we're still having is storing the vaccine, because Pfizer is we have to store it in such a low degree. I'm still wondering whether or not how we're going to give the shot to the children. I think school might be the best. Everybody go to your school, have the nurses there, and I'll be more than happy to help. Have the kids come to the school, and each school, it should be done in the school with the parents' permission, but I don't think we should have a site, a hospital, or whatever like we do for the adult. Just each kid, you go to your school, and I will be seamless. Very nice. If a parent, obviously doesn't want it, there's nothing we can do to force it. But I think that once that approval is made in the school, not in the doctor's office, not in the pediatrician office, then you have to make an appointment. They will have to wait. You can only vaccinate so many people. But in the school, I guarantee you, we'd be more than happy to volunteer and nurses and so on, and just go to a different school and just do that school. And that can be done very, very easy, very easy.
Thank you. If you'll put our slides up, because we have some submitted questions. And at this time, I want to invite any participant who has questions to put it in the chat so we can make sure we can address that. And then we'll go through this. So what were most people's experiences with COVID-19 aside from the most extreme? You mentioned this feeling of fatigue and exhaustion and loss of breath. But what I found very interesting, having lost people that I care about deeply too, is that it was so indiscriminate, like people that you felt were healthy that should not have passed or have had extreme experiences to COVID did. And so we're trying to figure out why that transpired with COVID.
I think that, it's almost like everybody react different to everything. You have a cold and you have different symptoms than different people. So it's not very, very difficult to really answer, because some people have a cold, they cough most of the time. Some people, they just have runny nose. Some people, they just have body aches. So, but there are some common symptoms, which is the loss of smell, the loss of taste, and the fatigue and the difficulty breathing. That was common with everybody. As a fact, we even had a page that tells what the flu looks like, the symptom for the flu and the symptom of COVID. If you have this symptom, you may have more flu. If you have this symptom, you may have more COVID. But again, it's intertwined, and we just have to have a high suspicion to go, have you been exposed? Have you been traveling? Have you been anywhere else? Have you been around anybody? And those questions were asked in my office on anybody who's coming in. We actually call them the day before to make sure we protect, because everybody has different. So if you feel that somebody has been exposed to anybody for upper respiratory infection, and that upper respiratory infection is really broad, then you really need to do your due diligence and really have that person need to have a test. But the post-COVID is just fatigue, difficulty breathing, because remember, oxygen is important. Oxygen is important.
Mhm.
And when you have lack of oxygen throughout the body, every single muscle is fatigued. You have to breathe. Sighing, as you know, when you're tired, you sigh because you need to get more oxygen to you. That's what the problem is. So I think different folks, different symptom, but we still need to make sure we are very vigilant to get people taken care of. Call your doctor, and I have to. We still can get tested very easy at Tropicana Field and some other places. So it's very easy to get tested now.
There's a question from one of our participants before we move on to the next question that was pre-submitted, and that is there any research on the effect of COVID-19 on immunocompromised children under 5 years specifically?
We have not shifted the so the way they do the I'm glad I saw Dr. Fauci the other day, so I'm gonna give you a very smart answer. I'm gonna sound like the head of the CDC, not the head of the CDC, the head of the whatever Dr. Fauci is running. So so we start with the adult, then we go from the 18 to the 15, the 15 to the 12, then the 12 to the 9, and I quote him, the 9 to the 6, and then we go on. So I think at this point, adults who are immunocompromised should get vaccinated. Remember, this is not a live virus, so we're not gonna hurt you. Even, again, pregnant women, it's been done, and so on. So it's getting there, because I think that those children have to be totally shielded from everybody else to make sure they are okay. Granted, they have less disease. Granted, they don't have as much symptom, but still, when your body is immunocompromised, as you said, everything's become triple, quadruple. So the research is being done, but not yet, but we're getting there.
Okay, will you put the next question up? We'll have to wait. Here we go.
Yeah.
How many people have you treated with long haul COVID-19 symptoms, and will the vaccine help people with those long-term symptoms? I myself know someone personally who had COVID for about 12 weeks, had to do all of her treatment through telehealth care, and continued to have these positive tests. And then after, for almost 3 months, had significant challenges with these long-term symptoms, random symptoms, and then finally got vaccinated after it was all clear. But how many people have you treated with these COVID-19 symptoms that have these long-term symptoms, and what do you think about them being vaccinated?
I can think of 7 right now, by just keeping my mind that still calling me on a regular basis how they feel, or quite a few, because not only did we do some testing in the office, but from the hospital, and people getting tested from everywhere and calling us, and there's a lot of people we never saw. We just, as you mentioned, did tele and making sure those folks were okay. So quite a few of them. And you're right, we had people who actually got better and end up in the hospital. I can think of 3 people we had to admit to the hospital twice. They got better, went home, and then come back again. And so, it's quite a few people. Now, what I think the vaccination will do, let me explain about the mRNA is not a new technique. It's been around for a long time, last 10, 12 years. We developed technology, and we're waiting to apply it. So this is nothing new. There's no live virus in there. So nobody's going to catch COVID from that. Let's make that clear. So the technology is there. I know the vaccine was rushed, if you will. But remember, nobody asked how long we've been doing Shingrix, the vaccine for shingles. Nobody asked how long certain of the vaccines have been in the makeup. We don't know that. But again, this was politicized. It's in the paper every day. Everybody's waiting for it, and we just wonder. So I think that having the vaccine, the first shot, tell your body there's something going on. The second shot, why a lot of people get a little sicker for 36 hours, That should be expected. Your body says, you're not coming in. I know who you are. And your body's doing every single thing it can to push that virus out. That's expected. So don't feel bad. I know a lot of people go, oh my gosh, I didn't feel good the first time. A lot of people say they had bad symptoms the second time. That's expected. You expect to have something because you're going to kick that virus out of your system. And the only way your body knows to do that is to have a fever, is to have some aches, everything you can to do so. So I think the mRNA vaccine will help to protect you. So whenever a piece of that virus is coming in you, your body goes, I know you, out of there. And that's what we're looking for.
So it brings me to another question from one of the participants, and that is, are you protected? What is your protection level? Or are you protected at all if you have the first vaccination, but not the second one?
I think I know where that question comes from my good friend Gigi. And the first vaccination, if you have Pfizer or Moderna, will it give you about a 60% protection. So yes, you are protected to some extent. You will have some antibodies. If you get antibodies done at your doctor's office, there's antibody to the virus if you had COVID, or you can have antibodies to the vaccination. That's kind of two different tests. We're not sure whether the quantitative value, what it means in the future. For example, for people to go to school, SPC, if you will, you have to have your measles and rubella, and we look at that in a quantitative value. You have to be above a certain number. Right now, we're getting a qualitative. We just know whether you're positive or negative, and that's for the COVID. What is the quantitative value mean in the future? That means if your level is a 2, you're protected. So are we going to be checking people on an annual basis to check the antibodies, if you will, to see where they are? Now, let me say something about antibody. Remember the IgM, M stands for the moment. So if you have IgM positive, that means you are infected. IgM, M for the moment. If you have IgG, G, you're grandfathered in. G, you're grandfathered in. So you have IgG, you are protected. You have IgG is good antibody. G stands for good. So the question is then, are we going to be checking people in the future? So somebody may get one vaccination, but your body may have developed enough immunity to protect. How do we know that? We won't. But as we do more testing, we might be able to have a quantitative value where you are above the threshold, if you will, not to have disease. And that, again, is something we'll know in the future.
And that brings me to another question from another one of our guests. It says, what do you think about Pfizer? Will we have a booster shot, and how important do you think it will be to get it? And will it be every 6 months, yearly, or what are your thoughts on that?
Again, the variants, everything mutates, different. That's why we have a different flu shot every year. And that's why the flu shot is not effective for everybody, because we have to figure out what strand and so on, and making sure we do so. So the problem is, as we know more about the disease, and as the disease moves into our bodies, doing different things, we're going to have to figure out exactly whether one shot is good enough, whether yearly, like the flu, if you will. We do not do any testing to see whether or not you have antibodies to the flu. Again, the flu kill 37,000 people a year, if you will, nowhere near what we're going through right now. So we still need to make sure everybody get their flu shot. By the way, still get your flu shot too, not around the same time with COVID, but still make sure you get your flu shot. So I think as we learn more, as we watch people, as we do testing, and in my office, I make sure I check people for antibodies, we'll be able to determine, wait a minute now, you had antibodies 6 months ago, what happened to them? And I think that's what they're doing now. The people who's been to the studies, they keep checking the antibodies to make a decision, how long did your antibodies last? If it lasts only 6 months, then you're gonna have to have a 6-month shot. If it lasts a year, you may have. I suspect it might be yearly, but maybe for a couple of years or so, until her body really develop enough immunity, enough fight to really get COVID out altogether. So it's probably maybe a couple of years, just once a year to make sure. But again, I think when you see your doctor, there's nothing wrong in just asking to have a analysis of your antibodies and looking for IgG positive. IgG has to be positive.
There's another question from one of our participants today who happens to be a member of our team too. Can you explain the distinction between public health versus population health?
Well, I think it's really one of the same if you were to put them together, because we should actually take care of everybody. The public itself, we're just trying to get everybody vaccinated, everybody taken care of. Then you have the whole, population, which is part of the public health. So it's kind of intertwined. I think that and it comes to an insurance issue also, public health, population health. People have doctors, people don't have doctors. So you could look at the public as an entity where they have no idea what the population, if you will. And you can in the public, maybe they have doctors, they don't have doctors. So it's really intertwined. But at the end of the day, I think it should be just health. And you do the best you can to, I guess, even all of the inequities that we're dealing with, trying to get everybody vaccinated. It's kind of a tough answer, simply because of the fact that we really we use that to maybe for fundraising, for all that stuff. But when it comes to health, it's really whether you're on whichever side you're on, we need to still do the same thing. And that is very difficult to reach out to everybody. And I think that's where the difficulties are.
We have some more of, I think some of these questions you have responded to, but we want to make sure we address them. We have over-the-counter medicine for COVID-19. Will we have it like we do with the flu? So eventually, will we get to the point where we address COVID like we do the flu in terms of symptoms, or are people already doing that now?
Well, we do have some medication. We, when somebody cover COVID, the first thing we'll tell them is get we need oximeter to make sure they check the oxygen. So they put their finger in there, they check the oxygen, whether it's Amazon, whatever the drugstore you use, get one and keep your oxygen above 95. If you start getting the 94s, it'll be below 94. So that means you're not getting enough oxygen. It's time for us to intervene with maybe some prescription medication, i.e. prednisone, or if you're still dropping, then obviously that hospital, because now we have to give you supplemental oxygen. That's one thing. The second, we've been pushing a lot of zinc, a lot of vitamin C, vitamin D, and overall fluid and taking care of yourself. Those are what we've been pushing. So we have the cocktail we tell all our patients to get as soon as they have that. But the most important part, as I keep saying, is breathing. As long as your oxygen saturation is above 95%, you can keep it there. So you really have to breathe to make sure you get up your system. And I remember even way back, way before, there was a couple TV episodes where this gentleman kept saying, I had to breathe. All I wanted to do was breathe to make sure I did not give up. So it's very important to breathe to make sure. Somebody has my phone though. Give me 1 second. Let me find it. 1 second. Sorry.
So of course we're live and we have a doctor. So while he is going to do that, and we will, if you will mute him, Kyle, then we will. If I would encourage you to put information into the chat, and also while he is gone, I'd like to emphasize that we have had 2 different sessions on COVID. The first session was with Unite Pinellas, and a scholar who talked about the data points and the importance of how it impacted us on the county. The second one was with the Florida Department of Health director for Pinellas, and that was a combination of discussing the long-term implications of COVID, the variants, and the vaccines available and how it's impacted us. And of course, this is our third one. So all will be available on our website. After this is done, the recording will be present as well. Before we get to this question that's on the screen, Dr. G, there's a question from another participant. Are there any vaccine studies or COVID studies ongoing in the area that you would recommend for African Americans participate in to know how they are affected or protected? And if so, how are these results studies shared in the medical arena and then possibly the public?
There are a lot of going on. I don't think they are sure yet. I know that Dr. Sneed, the chair of the pharmacology department at USF, one of my Boule members, if you will, very instrumental and doing a lot of research. And at the same time, we need to participate. We don't participate too well in research, and that's one thing we need to promote a little bit more. Our African American need to be part of that, so we can develop more initiative, if you will, to know exactly how to fight what we're dealing with. Dr. Sin has been very important in doing research. I know Mike Priest was involved in COVID research. I'm not sure which one, but we need to really get involved in research. But I can always get back to you on that, because I know Dr. Sneed, again, over at USF is really involved. Nothing has been published yet in terms of yet, but I do believe that on a personal level, one of the way to possibly keep yourself on a personal level is to really just have your doc check your antibodies every 6 months. You would actually know yourself. And I think for us, it also be a way for us to know how to treat you or try to apply it to population health, if you will, as we were talking about that earlier.
Okay, thank you. And the next question was, do you have any advice for employees or employers as they return to the office? I know that this is a hot topic. As an attorney, we've been talking about significant liability issues. No matter which way you go, if you encourage vaccinations, if you mandate vaccinations, if you don't mandate vaccinations, and how after a society has shut down, how we go back to a traditional work environment for some of us who have been completely isolated, other than the medical professions, of course, it is going to be challenging to return back to that level of normalcy. So what advice would you have to employers and employees as they acclimate back to work?
Well, you know, you mentioned the legal part of it, and I do believe it's more legal than everything else. You have the right not to get vaccinated. I have the right to get vaccinated. You have the right to be in the building without vaccination, possibly infecting a few people. I have the right to get vaccinated to make sure a few people don't, you know, don't get infected. So it's that constant battle. We have rights. And I think the right should be more of protection right. So rather than having your Fifth Amendment or First Amendment right, whatever you want to call it, First Amendment right, it should be more of a protection right. How do we protect each other? How do we protect you, protect me? And the other thing that people don't understand, it's not just your employee, it's your friends, it's your children, it's everywhere you go. So it's a domino effect where you come to work. And even at work, you are not guaranteed that somebody you're taking care of, somebody you come across, somebody you met at the water cooler who may not be vaccinated, might actually get you infected. So it's a rippling effect where the best way to handle that is to have a system where we all try to get vaccinated. So now there's a trust that you're okay, I'm okay, and I no longer have to worry and keep watching over the shoulder. Now, I saw one of my patients yesterday, and again, this is not a place for politics, but he tell me, I'm a big time, again, quote, I'm a big time Republican, but I do believe in vaccination, but I don't believe that I have to show vaccination cards if I want to get on an airplane, if I want to get in something else. And I understand that, but at the same time, if you get into an airplane, the next person next to you is vaccinated, you're vaccinated, it's gonna be a nicer, smoother ride than if you get into a plane and you have no idea the person next to you has not been vaccinated, you've been, even though you have that 5% chance of catching COVID, you have your mask on the whole time. And so on a psychological point of view, everybody else will feel so much better just knowing who you are, what you're doing, and everybody else. So the employee, as you mentioned, for our office, we finally had to tell everybody in the office, we're not going to mandate vaccination. We're going to strongly encourage it, close to the mandate, but not quite mandate. And so they finally understood. And when the patient come in, the patient are asking, are you vaccinated? Are you vaccinated? Then they felt they had to. So can we mandate it? I don't think we can. Can we encourage it? Very, very strongly. But I think each other, we should talk to each other and try to promote it ourselves. Everybody should promote the vaccination, so you yourself can actually live a little bit freer and breathe freer.
Thank you. I think we have one other question. I'm going to encourage our participants if they have any final questions, because we will be wrapping up after this question, and also mention that in the chat we have a link to what Dr. G mentioned regarding studies for COVID. When do you think the virus will be contained within our community, state, nation, and world? I mean, I think that, of course, when you talk about a pandemic, none of us are old enough to know what it has been like to live through a pandemic. And again, it's been a different space for everyone. We're trying to go back to normalcy, but when do you think that from a medical perspective, society will be able to really go back to normalcy? Not from the other perspective, but from a medical perspective.
So if you look at what we see in medicine, you need a 70% vaccination to get herd immunity, where everybody can walk around and feel free and breathe. As you know, I think the state has been open right now, maskless, to go just about anywhere if you want to. And I think that Pinellas has done very well. The state to some extent, Miami not so well. Again, depending on, I think the folks in Pinellas have been amazing. You know, we've done very, very well. We've had our share of COVID dead, our share of COVID hospitalization. We were overwhelmed at time, but nowhere near like the nation, if you will. California now is like 0 point something, you know, they recorded no death in 3 straight days in a row. I mean, it's like, wow, you remember what happened a while back. So I think that we're doing everything we can to contain the, so we have to start, it's almost like having that ripple effect you're talking about, the multiple circles within each other. You have your house, you need to contain it there. Then you have the city, you need to do that. Then you have the state, you need to contain, and then you keep going. So I think that, I know the government pushing for July 4th, if you will, so people can be a little freer, but we all have to do our part. This is where it all depends on us. So I really believe by, fall, we should be able to really, let's put it this way. I think after Memorial Weekend, we have a much better idea about where we're going, because again, there's going to be that gathering. There's going to be that gathering Memorial Weekend, and then 6 weeks later, actually 4 weeks later, there's going to be another gathering for July 4th. I think if our level don't go anywhere, if the levels don't go anywhere near what they did in the past, I think that's a big corner we've just passed. So I think that answer, I'm looking for it right after Memorial Weekend, what after July 4th, because remember, every spike is always right after that. This year, we weathered the spring break spike. It went up, but not bad. Mostly in Miami area, we're dealing with the variant. So I think that answer will really be more vivid, if you will, right after Memorial Weekend, right after July 4th. So as they stay on TV, stay tuned.
Well, I cannot thank you enough for your time this morning. I personally know how busy you are, and the community thanks you for the hard work of keeping us all safe during this pandemic and your commitment to our community. So thank you so much for your time today. And we're going to scroll off. If you have
thank
more
you
information,
so much for inviting me. And I don't think anybody says no to Squire Jackson. Am I dismissed?
You are dismissed, sir. Thank you so much.
Thank you so much. And feel free anytime to reach out, any question that I can answer. This was a pleasure. I totally enjoy it, and hope that I've been able to help some folks. And thank you so much. All right.
Thank you. Thank you. So we have our final couple of wrap-ups for our sessions. So we have our 2021 Pinellas County Legislative wrap-up. So if you're free to join us on Monday, we hope that you will. And I think we have one more program for the end of May. We have our food insecurity from an intergenerational standpoint, and that's sponsored by AARP. And that's going to be Wednesday, May 26th from 12 to 1. And if you want to learn more about ISPS, we again invite you to follow us on Facebook, check us out on Instagram, support our website to learn information, and just to give us questions about what you and input about what you'd like to hear us discuss more. We're so grateful for your time, particularly this early this morning. And we appreciate you following us for our 3 COVID series. It's been a pleasure to be with you today. And again, many thanks.